Illinois is investing $150 million in new initiatives to support communities most in need of health care. It's possible through a bill that Governor J.B. Pritzker signed into law today. Capitol Bureau Chief Mike Militich joins us live in Springfield. Mike, who will this help?
Tyler, good evening. State lawmakers say this plan could help districts that have been severely disadvantaged over the years, especially in small towns across central and southern Illinois, even metro areas that have many black and brown neighborhoods. A bipartisan group of legislators started work on a collaborative care plan 18 months ago. Now, this was a major need because changes were needed in every community in order to increase access to hospitals and specialty care centers. House Majority Leader Greg Harris led the group in discussions with safety net hospitals and community groups. He said this law proves Democrats can work with their Republican colleagues and service providers in order to enact change.
This is one step that in a long road that we're going to have to reduce the disparities and the inequities that have been shown to us.
Harris said lawmakers should be happy with their accomplishment, but they must get back to Springfield to work on more improvements for the future. Legislators have the opportunity to pass even more changes by looking into the Maine Black Caucus position in order to have more health care reforms. They tried to get a bill passed during lame duck session. It failed to gain enough support, but they could get it through the House as early as next week. For now, reporting live in Springfield, Mike Militich, 25 News.
Mike, thank you. With the stressors of the pandemic stretching into a full year, addiction and mental health concerns are issues more people now face in Illinois. Advocates want lawmakers there in Springfield to step up and make sure that insurance is not a barrier. The state policy director for the Kennedy Forum Project in Illinois said mental health issues and suicide have been on the rise in the past year. David Applegate says in 2020 alone, Illinois saw the highest increase in rates of suicide and overdose among black people.
It's the people that lack the social and economic resources to fight these wrongful denials that are going to most benefit from putting these standards into place.
He says it's all about leveling the playing field to ensure that health plans cover every person in need, possibly saving the state money in the long run. That committee plans to meet again next week.